somewhere in school, but they do not do manual blood pressures. They slap on a machine, and you can check your blood pressure with the machines, check the pulse, check those kind of things, but all vitals have to be manual to start with. Carry a spiral bell notebook, whatever you want to carry to keep your notes in. I wouldn't come in with luggage. I would come in with 17-foot bags, and don't be a geardo. Gentlemen, these firefighters are all geardos. No geardos in here? All right, good. There's some definitely, you don't want to carry a whole bunch. Because one, you lay it down on the desk, it's going to walk. Two, it's just going to slow you down. That's one of the biggest things. And you need to be mobile, and you need to have your hands free. You don't need to be holding 17 things all the time. So, if you do bring a water bottle, we have what they call hydration stations, and they are at each nurse station. You must keep your water bottle on that hydration station. It's a little map. There's a reason for that. An organization called Joint Commission. And they come to the hospital randomly every couple of years, whenever they want to, and those are violations. And we get docked for that. It's not a matter of money, and it's not a ticket, but we can lose certification. Where we keep drink, food, all those kind of things, pretty important, because you may have your water bottle right here and a bottle of urine right here. Personally, that weird me out. All right. Here's a patient progression through the ECC and the MTC. For arrival, your waiting room, those are going to be your walk-ins, drive-ups, whatever. Those are usually going to be your patients who have a headache. They got in a car wreck 4 days ago, and they're sore, they want some medication. They got an STD, and they need some Rocephin. That's where these patients are going to come. All right. The second way they're going to come in is how you're going to be primarily concerned with. That's the EMS entry. We just recently went to a code. We don't go in and out those doors unless we have a patient or we're doing patient care. Okay. When you get on the bus, they'll tell you those codes. But just remember, you walk out those doors, you're not going back in the same doors. Okay. Zone X. These are going to be lower acuity. Somebody who has random leg pain, somebody who has a very minor headache, sniffles. Like I said, we get a lot of STDs through Zone X. Zone X is 8 bays, and that is keep a nurse and a medic there, generally, and one provider. They do quick care on those patients, try to get them in and out. They're walk-ins, so turn and burn, get them gone. Zone 1 is going to be lower acuity, but maybe that's the guy who got in a car wreck a few days ago. He's having neck pain, and we need some x-rays. You got the patient who's got a history of some minor kidney problems, and we need to do some labs. They're going to be there for about 6 hours. 6 to 8 hours is about what they average in Zone 1. There are 14 rooms in Zone 1. One of those is a SANE room, or a sexual assault room. If it's open, it shouldn't be, but if it is, do not look in there, do not go in there, do not ask to work in there, avoid, run, be away from that. As students, you do not need to be involved in a court case later on. That is a crime scene once the patient is in. And if you touch your foot in there, you're part of it. All right. Zone 2, this is where we get into medium acuity. They have 2 bays in the CPR room. Same thing with Zone 3. They also have 2 bays. When I say medium acuity, this is somebody that we expect to possibly go upstairs and have to be admitted. Somebody who has serious, I keep mentioning kidney problems. We have a large dialysis program at Grady. We get a lot of renal failure. We get a lot of end-stage problems. And they come to the ECC and we have to do dialysis right there on site. If they're not serious, they might get stepped down, which is what we call going upstairs. They're stepped down in acuity. This is where you're going to spend day 2. Vitals, more vitals. But in Zone 2, work on getting histories. Work on learning what a sick patient looks like. And if they are a strange yellow color,
liver.
liver. There you go. You see some strange colors come through there, I promise you. You're going to see yellow, purple, orange, green. You're going to see all kinds of colors. I've never seen anything like it. So zone 2 is where you're going to spend 12 hours on day 2. Work on your history taking. Work on diagnosing the patient from the door. And look at them and say, hey, this is what I'm seeing. Check their vitals, get their history, and see how it matches up. Okay? Sometimes you're going to catch something that medics do, simple stuff, that you're going to be a real asset. All right? Zone 3, the only reason that you're going to be in zone 3 is to go to the CPR room. There is a critical care area in zone 3. These are patients who they really need to be upstairs in a critical care area, but Grady's only got about 900 beds. I say only because we need about 1,200 beds all the time. We're always short. The ECC houses a large number of very sick patients for a very long time. We've seen them in there for 2 weeks at a time. That's a long time to be at the emergency room. So that's why they had to create that critical care area. MTC, again, it's all trauma levels 1 through 3. You'll learn about those when you come to the hospital. I'll give you a list if you'd like to know what that criteria is. I don't know if that's something we'll class. So acuity is based on mechanism of injury, the current vitals, that kind of thing, age. So let's go through the map, and I'm going to show you again. We're going to go through this progression again. So you guys see over there? Generally, you would come in here near the ambulance bay. That's been shut off. There's a door right down here. Okay, it's either here or out here where the emergency room entrance is. All right, you can come in and ask any security guard, any nurse, hey, where's Huddle? They'll tell you where it is. All right, find somebody in scrubs, just say, I'm here for school. Where's Huddle? There's the auditorium. That's where Huddle is. So when you come in, you're going to meet this first main hallway. You're going to take a left and go to where you can't walk anymore. Take a right, and you're going to go down. Turns into, there's a ramp right here. You'll see it on the left-hand side. Walk down that ramp all the way to the auditorium. The entrance is at the back. All right. Find a place and wait. It starts. It automatically starts at 7 o'clock. Please don't be late. Okay. That's where you'll get your assignment. If I'm not there and I can't give you an assignment, go ask the charge nurse where you need to be, or let them know I need to be in zone 1, X, or 2, depending on your day. Or if it's day 3, let them know that as well. Do you have a punch card system yet, Kayla?
No.
Okay. After huddle, you go to the appropriate zone, day 1. Zone 1, zone X is this part of the ambulance bay. Okay? You can rotate back and forth. We want you to split up. If there's 2 people on a team, we want you to split up. One go to zone 1 for 6 hours, one go to zone X for 6 hours. Let them know. And now if zone X is closed, let me know, and I'll make sure that I get you put somewhere. There's plenty of work in zone 1, but at mid-shift after lunch, you're going to swap. Okay? Zone X should be in and out. You're going to take a lot of vitals. They bring everybody from the emergency room and come back there. The nurse shouldn't be taking any vitals. Okay, that is one place that you do need to take all their vitals. Same thing with zone 1. If they say, hey, every 30 minutes I need vitals on this patient, click them out. All right, be consistent with it. And also when you're talking to these patients, maybe not so much in zone X, but in zone 1, ask for an update. How you feeling? You feeling any better? Did they give you some medication? What was it for? Try to get a full story and try to work on your diagnosis a little bit. Day 2, this is zone 2. All right. The only reason that you'll know that it splits, CPR 2 is here, CPR 3 is here. There's an imaginary line, much like a timeline on the map. You don't see it, but it runs through the middle. Separate zone 2 and zone 3. If you're on this side, or if you're CPR rooms and this side, you're good to go. All right. You're going to have a lot of hall patients. Going to have a lot of people asking you questions. You're going to say, hey, I need some pain medication. Hey, I need this. I'd like a sandwich. One thing you need to make sure you don't give anybody any food, no intake, without checking with the nurse first. Labs may be pending. Okay? So, no Grady mystery meat sandwiches, no apple juice, no anything. You're going to be helping patients to the restroom. Work on, helping that patient up safely. It does matter. So work on how you deal with these patients. Day 3, zone 3 CPR is right here, and of course Marcus trauma is here. The main bay is your first one on the right-hand side as you walk in. That's the master bay. That's where we're going to have the serious level 1s coming in. And that's where you're going to find a team descending on that room. It's going to be nurses, doctors, RT, X-ray. It's going to be everybody. Neuro, if you're working on strokes, they're going to be right here in the ambulance bay. They're going to meet them at the door. Okay, if you hear a stroke coming in and you need to do a stroke assessment, whatever, then make sure you meet them right there. They're going to end up going to CT right over here. All right, any questions about your days so far about how the rotation works? What's day 1? All right, day 2?
Zone 2.
And day 3?
Zone 3 or Marcus trauma.
Okay. We'll go to trauma. What do we do with our hands?
Don't touch anything.
Just don't get yourself in any trouble, and it's not a matter of somebody getting onto you. But once you touch a patient, you're part of that patient care team, and if you're doing something outside your scope, you get some hot water. Okay, we don't want that. If a physician directs you or a nurse directs you to do something, obviously help them. Be curious, want to do things, but don't just volunteer yourself. All right.
So would we be charging for Marcus trauma if we don't touch a patient?
Yes. Is it the same with the critical care area?
So you probably will not make it to the critical care area, and that is just a super high acuity. Generally, you're going to be, and if you talk about, if they ask you to come out there and help, you're more than welcome to go back and help. They say, hey, we have to do a procedure. You want to come watch? Yeah. Relieving cranial pressure, putting a bolt in somebody's head, go watch. By all means. Is that something that you're going to touch on the truck? No. If you've got 15 sets of vitals left on your list to do, should you be going to watch something else? No. But if you're done with if you're getting close to your list and you're on track for everything, you get those opportunities. Even if they say, hey, help me pull his chest back. All right? They're not going to. Please take advantage of everything that you're offered. Just let them know what your scope is, though. Say, well, I'm a student. Okay? Dr. Benjamin or Dr. Todd says, I told you to put your hand right here. Well, get their name, document it, and then go with that, right? Documentation is king. If it's not written down, it didn't happen. Same thing with every call. Yeah. So there's a couple of things. If you're in Marcus trauma and they say, hey, we need to take special OR, I'm going to tell you to ask. I go with you. You're not going to be able to touch anything. You're not going to be able to do anything. But you can open doors. You can help with a stretcher. You can handle cords. You can do that kind of stuff, right? If they're going to CT, obviously, go get a good picture of what that looks like. Because when you're taking patients there for neuro, shoot, watch, ask. They're going to tell everybody out of the actual CT room, obviously, but also in the office where they actually are doing the computer work. Tell them, hey, I'm a student. Can I please watch? Get in the back, watch. And when they say, hey, it looks like you've got a bleed, ask them to show you so you know how to read those. And you're not going to know everything about it, but just get a good look at it. The helipad. Do not go to the helipad unless you are attached at the hip with a nurse who told you to go to the helipad with them. All right? No selfies, no phones. You shouldn't be up there doing that. All right? So if you're asked to go, you may go. But do not just take it upon yourself to tie a office. Right? That's important. You'll get in trouble. Another thing you get in trouble for at Grady is smoking on campus. I don't know if we have any smokers here. If you do, is that bad for you? You determine that in 70, you should know that. First off. Second off, it is strictly against the rules at Grady. If you're seen in a uniform doing it on Grady campus, it's going to be addressed.
You guys said vaping as well. It's not just cigarettes. Anything tobacco or vaping.
Off limits. All right? You got to do that. Good luck. need to cover this again with anybody. How do we take our vitals? All right, how do you check them? You can check with just Dynamap, okay? You don't know how to use one, ask the nurse. I've never used anything like this before. The reason why you might want to know how to use it is when you bring a patient into ambulance triage and you're helping those nurses out and you're being nice and, you know, like, here, let me do your job for you. You can use Dynamap there. All right.
Question.
Yes.
If we're doing that and somebody like breaks sepsis code or something and we need to transport them to trauma, do we just like pull the friend, let us know?
Oh, obviously, you gotta be working with a nurse anyway.
Right, so we
And just bring it up to the nurse and say, hey, you know, they're tachycardic, blood pressure's all over the place. They don't look good. They're febrile. They're gonna pick it up pretty quick, okay? Sepsis alert, we go to CPRs. Would not go to trauma unless it's been like a 16-hour open tip field and they're starting to, you know, starting to get affected. But yeah, that is something that you obviously want to bring up. Again, vitals, that's your superpower. I'm telling you, you're gonna pick up 90% of what you need to know by figuring out how the patient's feeling. All right, put your hands on the patient. Work on getting a history while you're taking a pulse. All right, obviously you need to take a full, how long are you doing pulses? All right, at least 30 seconds, at least. All right, when you get good at it, you put your hand on somebody's wrist and say, man, they feel like about 80. And they feel like 140. Of course, if they feel like 140, you want to do that again. They're gonna be a problem. Put your hands on your patients. You're